All right, this is Dr. Nick Wilson. This is the Ask Dr. Wilson show. And hey, this is a show where I try to bring you natural health tips, inspiring stories. I try to bring you the most, relevant health information possible so that you can live your best life right now. And we're talking here lately a lot about what's the most common subject that everyone's asking about, talking about. It's all over the news. It's the virus. And more importantly, I think, is our reaction to the virus more than just the virus itself. And, currently, I don't love talking about the virus. You guys know that if you've been listening to my show. I don't like talking about it because I intentionally avoid the news. I intentionally avoid maybe fear-driven media, or what some might call a new word, panic porn. I didn't make that word up, just heard it said. And what do you get when you watch the mainstream media is just a lot of bad news and just a lot of maybe inflated numbers. And unfortunately, we're getting a lot of misinformation. And maybe it's purposeful. Maybe it's someone doing their job. Maybe it's someone, paying for the fear and panic right now. But my show's always been about good news. My show's always been about how to live your best life right now. And I'm going to keep going with that because you're not hearing the real statistics on the other side. And so my purpose, I guess, is to give you a different perspective than what you're hearing in the mainstream. As an example, you didn't see this headline in the news this week. The CDC guidelines say wearing a mask during prolonged exposure to COVID won't prevent possible infection. You won't see this other headline in the news. It's from The Lancet. Full lockdowns did not prevent the spread of the virus. During the show, we're going to talk about something else the CDC said. Face masks with valves do not prevent the spread of the virus. Also, neck gaiters, those stretchy things you pull up over your face. It says neck gaiters increase the likelihood of spreading the virus. I mean, guys, you can't make this stuff up. And yet, you go to the grocery store, you go out in public, what do you see? A lot of people wearing those face masks with the valves. A lot of people wearing those stretchy things you pull up over your face and nose. And yet, you see the numbers right now. You see what the statistics are currently. And I think we need to ask ourselves, are we still in a pandemic? Maybe one of the questions is, was there ever one? Maybe it's a different topic for a different show. But listen to this. The median age of death from the coronavirus is 78, which is actually the average life expectancy in the United States, by the way. The 75 and older group are just 7% of the US population, but now they account for 59% of COVID-19 deaths. Only 2.1% of ER visits are for COVID symptoms. Only 1.9% of active cases are hospitalized. Only 0.014 of Americans are hospitalized with COVID. And only 0.7% of Americans currently are testing positive. We've now conducted 41 million more tests than any other country. So consider this. 41 million more tests than the next closest country. You're wondering why we have a high positivity rate here in the United States. Well, the FDA just came out and said that the test that is the most prevalent and most widely used test that is showing a high incidence of false positives. So we're getting a high incidence of false positives. So people who don't actually have COVID are getting tested saying they have COVID. They don't have symptoms. Now what are they? Deemed an asymptomatic spreader. And so what do? They have to quarantine or self-quarantine. And then what do you also have? You have Americans who, let's just face it, friends, Americans as a country were sick. 5 out of 6 Americans, if they die of a disease, it's still heart disease or cancer. Let's not forget that. We have right now over 800,000 people every single year who die from heart disease, over 600,000 people who will die from cancer. We have diabetes that is on the rise. You look at the fact that unfortunately, our medical system, so iatrogenic, which is doctor-induced, or nosocomial, which is hospital-induced deaths, are actually coming out to 250,000 every single year. So let's not pretend that we are healthy people and just randomly dying from this disease. No, we are, as Americans, we're sick, and there is an opportunistic virus that is, let's just call it a spade here, is mostly affecting the sick and very elderly. Again, the median age of death is 78 years old. That's the average expectancy, the life expectancy in the United States anyway. I don't want to minimize the fact that every life matters. I don't want to minimize the fact that even one death is tragic. However, there is now a 600% increase in suicides in this country. 25% of young adults in June alone contemplated suicide. We had a visitation from the health department. We've had multiple now for my business. And the last citation that we received was a violation because we're not requiring our patrons to wear masks. Every time the health department has visited us, we've tried to hear their advice. We've tried to do our best to, guys, friends, I don't really want this, I would call it sideways energy of having to deal with the health department. So even though I don't agree with what they're saying, I try to make the most logical decisions that we can and make the changes, at least the changes that they're wishing us to make. I try to do my best to try to stay within the playing field, if that makes sense. So their last visit to us said that we need to do a better job of regulating within our clinic the wearing of masks. We bring up the fact that there are exemptions, which, friends, if you don't know this, there are exemptions to the mandate. There are exemptions. There are health exemptions. If you have a health problem that would prevent you from wearing a mask, that is built in to the exemptions. And so the health department said, well, they have to verbally tell you they have an exemption. I said, well, many of these people are my patients and they've expressed to us in the past, and I know their health history. I understand their health status because they've told that to me. At some point along the way with their health, I still need a verbal exemption when they come into the practice. He said, yep. So I said, okay, I'll do it. So when somebody comes to the door, I'll pay an extra person to stand there and let's just say screen and make sure that anyone who's not wearing a mask, they have to verbally say they have an exemption. So we did that. And what happened? Well, a person came in who's been coming in. She has anxiety. She has medical reasons why she would not wear a face covering. And yet, at the door, we screen, she sees the new sign that they told us that we had to put up. So she goes back to her car. She puts on a face covering. She walks in and she has a panic attack. Her heart rate goes through the roof. She's sweating. Here you have somebody who we do our best to always do the right thing. Provide a place that's a safe place in our clinic. And here we're just trying to be compliant on some level. Yet when we are being compliant on that level, it caused mental, emotional, and physical stress to one of my patrons, to one of my clients, to one of my patients. This isn't about my business right now. We'll be fine. We're going to be okay. We're going to figure this out. It's not just my business. I feel like right now we have to stand for those who can't stand for themselves. When we called the health department, we talked to the health department and said, hey, there are people with real reasons why they cannot wear masks. We can't just force everyone to wear. They can't wear them. We didn't get into the fact that masks don't work, and we didn't get into the fact that, hey, some of these face coverings actually perpetuate the spread of the virus. We didn't get into that. Just simply, hey, some people can't wear masks. And when we brought up all the reasons why someone can't wear a mask, when we brought up anxiety, the person at the health department started laughing. And she said, no, we're talking about real health conditions, not anxiety. And here you have a whole system that is built on the fact that we don't recognize mind and the influence on the body or mindset or even spirituality or faith. We don't recognize in medicine, we don't recognize the influence of faith on the body or mindset on the body. It's laughed at. And yet, here's someone puts on a mask, has massive anxiety, has a panic attack, and has physical, I feel like there was physical harm done because she thought she had to wear one. And again, it's not about my business. It's not like I'm the only business that's being affected by this. Did you see in California, Pastor Jack Trieber of North Valley Baptist Church, he opened his church. Now, here's the thing. This guy, he shut down. He played fair. When it was the pandemic, they said, hey, we've got to flatten the curve. Let's shut her down. He shut down for 22 weeks is what he shut down for. They said there was going to be thousands of deaths. There is not thousands of deaths. There's not even 900 deaths. There's not 700 deaths. There is just over 200 deaths out of 2.1 million people in that area. And he said, I'm going to open back up. He was during the virtual preaching and he said, I'm going to open back up. The people are begging to come back. They do homeless missions. They do prison missions. They do missions all over. They bus people into the church to those who can't afford to get there on their own. And he said, what am I to do? I feel like that we can't continue this way, so I'm going to open it back up. He received a $10,000 fine and a cease and desist because he allowed the people to sing in church. And in California, that's a violation. To sing in church is a violation. Did you know that? Not allowed to sing in church right now in California. You can go to a restaurant, take your mask off, and have conversations, but if you sing in church, that's a violation. So he receives a cease and desist, a $10,000 fine, and here he is. He's wondering if he's going to jail next week because he's doing it again. He's an older guy too, 14 grandchildren. Might go to jail because he allowed people to congregate at his church. He preached to them, doing what he believes is right, what he is actually called to do, what he feels like he's called to do. And now he's questioning whether the government is overstepping in this way. And he seems like a nice guy. I've heard him speak several times now. He's trying to be nice. He's trying to be fair, but he's also standing for what he believes is biblical truth and also the Constitution, which should protect the church and should protect the little guy. But what do we have? We have overstepping and we have overreaching right now. The pandemic emergency powers have been overextended. They've been overextended. They say it's to protect, they're supposed to be protecting us. Come on, if they're protecting us, really, if the whole measure is to protect us, why are they leaving the sale of cigarettes to continue? Why are they leaving? We know that comorbidities are a big factor of whether you get the virus and spread the virus. Why are we leaving fast food chains open, yet we're shutting down small businesses? We're limiting capacity in small businesses, yet you can just drive through the drive-through all you want. So you're telling me right now, I can go get a Big Mac. I can get a 22-ounce Coke. I can just guzzle that thing down, and I can go smoke. I can take my mask off to do all of those things, yet this guy This pastor, Pastor Jack, he's the one who's a problem right now? Friends, if we want this to be over, if we really want this to be over, here's what we do. We stop performing so many tests and we turn off the media. Pandemic is over if we do that, just so you know. Turn off the media. Stop testing so many people, because what are we finding? We're finding a lot of people who are positive for the virus, yet they're asymptomatic. They're not actually infected. Again, the false positivity rate just creates anxiety. It creates a low-level stress. They're not spreading the virus. Look, the World Health Organization came out and said asymptomatic people are not the ones responsible for spreading the virus. Yes, they backtracked that comment because it doesn't fit the narrative. She was talking about all the evidence that she was gathering. If you actually listen to that news story, and again, the fact checkers on social media, they're like, it's that she backtracked those statements. You can't use this as a reference anymore. She was using the available data. She said, based off of the available data, asymptomatic spreaders are not they're not the ones that are causing problems. They're not the ones spreading the virus like you're being told. If you know anything about a virus, viruses are not living. So what does that mean? That means it requires a host to then infect the host. And once the host is then infected, boom, now you can spread a virus. But I want to remind us all, friends, the attack on germs, the disinfecting our world, our removal of ourselves from society and then socially distancing ourselves from any human contact, we're just setting ourselves up for a second wave of sickness and disease when we start doing those things again. Look at just new teachers. New teachers are always sick the first year. Look at new doctors. They're always sick their first year. Why? Because their immune system is not used to being exposed to the amount of people, the amount of germs, the amount of viruses. They're just not used to it. But what does year 2 look like? Well, they're stronger, they're more resilient. And yet, what are we doing? We're setting ourselves up for the minute that we open back up society and start getting around each other more. Stop with the toxic hand sanitizers and stop with the disinfecting our countertops in our world. Even though, by the way, COVID doesn't live on surfaces. We know that. Yet still, what do we insist on? Spreading and spraying, the disinfectant all over everything. Listen, if there's a 0.1 chance of rain today, I'm not bringing an umbrella outside. And I'm not going to be appalled if nobody outside is using an umbrella. At this point, I would feel safer if this virus gave a press conference to tell us how to save us from the government. I think the point that I want to make right here. We've conducted 41 million more tests than the next closest country. Only 2.1% of ER visits are for COVID symptoms. Only 1.9% of active cases are hospitalized. Only 0.14% of Americans are hospitalized with COVID. And only 0.7% of Americans are currently a positive case. And that's with the inflated numbers. I just got a message from somebody with a picture of I've got this right here in front of me. This guy goes in for knee pain, and it says on the code, health issue, pain and inability to weight bear right knee/leg. The diagnosis, you ready for this? Suspected COVID-19. Not only the diagnosis, but the diagnostic code is COVID-19. It says display name suspected coronavirus disease caused by severe acute respiratory syndrome, coronavirus 2. That guy who went in with knee pain was tested for COVID and now is one of the positive cases for COVID. No symptoms of COVID, only knee pain, and now he's part of the positivity rate, which is being used to perpetuate the idea that this is actually worse than what it is. And allow government overreach and shut down society. When all the kids went back to school and college, what did they have to do? They had to get tested. If they had any symptoms, have to get tested. When all the kids went back to college and all the kids got tested, do you think there was a handful of them that tested positive for the coronavirus? The answer to that is yes. When they tested positive for the coronavirus, did they count as a positive case? The answer is yes. Now here's the real question that we have to ask ourselves. What is the likelihood of someone under the age of 25 actually dying from the coronavirus? You ready for this number? It is 0.0002%. Friends, if you would have started out with the pandemic in March, and you would have said that, hey, there's going to be a virus that's going to come, and it's going to have between 0.2 to maybe 0.1 fatality rate, and that's what it's going to be, no one would have shut down society. No one would have said we need to close our schools. No one would have mandated mask wearing or face covering or social distancing or closing churches. It would have been laughable if someone would have said that, hey, it's going to be the fatality rate is going to be between 0.2 and 0.1, which, by the way, that number is still plummeting right now. With the increase in positive cases, that number is still going to plummet. A new virus, you have to go back 3 years later and look to see what the actual fatality rate is, just so you're aware that they say it's a new virus and everything, it seems like everything's gone out the window, by the way. All physiology, all of epidemiology, all of the things that we know about germs and viruses and everything seems to have just been thrown out the window with this new coronavirus. But if you would have said that, it's going to be 0.2, 0.1 fatality rate, it would have been laughable to take the measures that we've taken. It would have been asinine. Health experts would have gotten on TV and they'd have said, wait a second. No, we don't need to do that for that type of virus. Yet now that it's become, let's say, political, now that it's become something that has to be justified in order to keep a seat in public office, now that it's become more of the norm and fear has become a virtue, now what do you have? Now you have people who are violently defending the mandates. You have people turning in business owners. You have people governing other citizens, tell them to pull up the mask. I just received a note from someone, she's a parent of a 7th grader who received a direct letter from the school administration, the Dean of Student and Family Care, that says this, and mind you, I'm going to read this. This is directed to a 7th grader. It says this: have you ever poked a hole in a balloon? Not a stab that makes it pop, but cut a little hole down by the end where you tie it. What happens when you do that? Well, it's not much different with masks. When we say wear a mask, we mean cover your nose and mouth with a mask. We do not mean hang a mask off of your face. That's like putting a hole in a balloon. What's the point of that? Chin protection? It's certainly not keeping air in. It would be really great if you would just put on your mask all the way up over your nose. And if you are unwilling, you are demanding that you are more important than everyone else. You may not think you mean that. You might just say, I hate wearing the mask. But when you pull it down, you are saying both. I heard another school was giving detentions for doing that. I would love to go all year without having to do that even once, but that will be completely up to you. I like being here at school. I assume you do too. Help us all stay that way. That was directed to a 7th grader. At what point have we given up all of our rights and also given each other permission to just be flat out rude to each other? I don't think that person would have said that to a 7th grader if mom or dad would be standing there. We've given permission for people to be mean, to bully. We've given ourselves permission to just say and do whatever we want. The customer service has gone out the window during this. What happened to tolerance and acceptance? What happened to coexistence? What happened to all these principles? Seems like it's gone out the window. Let's turn off the TVs, turn off the media, stop scrolling and clicking on the clickbait. We know that bad news sells, good news doesn't. If you read in the paper that it's going to rain today, you're more likely to pick it up than if it says it's going to be sunshine. So we understand that bad news sells, but here's the good news. And I want you to hear this. If you or yourself or someone you know or love have been exposed to COVID-19, new study comes out and shows you have lasting immunity. That's great news because that's what creates herd immunity. That's what real herd immunity is, by the way, is naturally occurring instead of artificial immunity, which is very different. Great news, we can develop herd immunity the more people who are exposed. So those people who are exposed, those are the heroes. Those people who are exposed are the real heroes right now. Herd immunity happens when more people get exposed naturally. You cannot trick the body into health. You cannot artificially stimulate health. Health is built from the inside out. The body doesn't need any help. Just think about how brilliant the body really is. Think about the fact that your heart is beating right now. You don't have to think about that. Your lungs are breathing right now. You don't have to think about that. You're breathing in 1,800 different microbes right now. You don't have to think about filtering that out. You don't even think about what your immune system has to do to build up immunity to all these different microbes. You don't think about the 100 different chemical reactions that are occurring inside your body right now. You don't have to think about every 120 days that you get a whole new set of red blood cells, or every 8 months that you get a whole new set of lungs. You don't have to think about the fact that if you fall and scrape your leg right now, that the body goes to work for you to send clotting agents to scab that over and to heal that wound. You don't have to think about that because the body is brilliant. And what you're seeing right now is two diametrically opposing views when it comes to faith in the body, maybe even faith in God, a whole system that is built around fear, and a whole system that is really built around the idea that we have to trick the body into health and we have to all shut down our lives and just wait for the upcoming vaccine to get back to normal. I'm not doing that. I know a lot of people who are not doing that. So if you're counting on all the people in order for herd immunity and counting on the whole population to do that, it's not going to happen, friends. There's no chance that's going to happen. There are people that is against their religious convictions, that is against their philosophical beliefs. And I know they've been trying and attempting to remove religious, philosophical, and even medical exemptions to vaccinations. And now you might see why. Now you have good insight on why it's necessary for you and I to have those exemptions, because there's a fast-tracked, untested, unproven, warp speed to market vaccine that is on the horizon. And if you and I don't have any exemptions to that fast-tracked, warp speed brought to market by a drug company, the leader right now is Moderna, who has never brought a drug all the way through the market, all the way through the FDA. And they want to make that mandatory. And you might say, hey, they came out, Fauci and others have said that they're not going to make this mandatory. You just wait. Wait until you try to enroll your kids in school. Wait until you try to enroll your kids in college. Wait until you try to travel internationally. You just wait. No, they might not make it mandatory. They may not make every citizen get it. You're just going to see privileges being removed if you don't stand up, if you don't take a stand. This is the reason why I think this is more important now than ever, and I've spent so many shows on this topic, because we have to take a stand. We have to speak up for those who can't speak for themselves. And listen, How do we stand? One of the ways that I take a stand for me and my family and the people who are in my circle of influence is by going to standforhealthfreedom.com. Stand for Health Freedom is an organization that helps people take a stand, reach out to their local governing bodies just with a click of a button, finding your local representative with a customized message saying, hey, this is my belief. This is where I believe we should vote, and this is what I want you to do about that. And just with a click of a button, it sends it to all your representatives in your individual area. It's as simple as that. Instead of looking up who your representatives are and drafting an email and trying to make this customized to them specifically, it pre-populates all of that, makes it very simple for you, and even provides a customized message if you don't feel like drafting the message yourself. You just have to go to standforhealthfreedom.com. My wife, who is a health freedom attorney, is an executive director for Stand for Health Freedom. And so again, standforhealthfreedom.com. That's how you can get more information there. This is Dr. Nick Wilson. This is the Ask Dr. Wilson Show. Facebook.com/Ask Dr. Wilson. Find me on any of the social media platforms, mostly censored, at Instagram, Ask Dr. Wilson. They're on Instagram. You can find me on YouTube with the same Ask Dr. Wilson. People ask, how do I listen to the show? You can listen on the podcast, anywhere where podcasts are played. The Ask Dr. Wilson Show, the Detox Lifestyle. You can find it there. You can go through older shows or just get on YouTube. Hey, some of our workshops are posted directly to YouTube. That'd be a great way to get plugged into the culture here in locally Indianapolis, but just in general, the culture of natural health, healing, learning how to take care of your body. I've got a lot of good information directly on YouTube for that. Hey, remember to think, but let's not think like the rest of the world. When the culture is falling apart right now, it's okay to think differently. It's okay to look differently. It's okay to have a different mindset right now. And it's actually good to be vocal. We can't be silent. We can't sit on the sidelines. People say there's a silent majority of something out there. I would say this, that the silent majority is going to continue to be silent. And we're going to let the noisy gongs be the loudest voice and win the day. We can't let that happen. So be bold, be courageous, be confident, and remember that in the end, truth wins. We can be confident in that. So make it a great rest of your day, and I'll see you next time.